Media Availability today. My name is Tim Hyder. I'm a Public Information Officer for the Health Information Center for the COVID response. I'd like to introduce Dr. Paul Cieslak, Senior Health Advisor and Medical Director for Acute and Communicable Diseases and Immunizations with the Oregon Health Authority. Here are some reminders before we start. This is a call for our media partners. The public is welcome to listen in, but we'd like to reserve this time for the media. We offer the public space during our Facebook Live events. Please sign in with your name and the media outlet you are represented. If you'd like to ask a question, send a direct email to our host. And I would ask you, at least initially, if you could, you'll find, you'll see the instructions for naming yourself in the instructions there. I would ask initially if you could at least limit yourself to 1 or 2 questions, and then if you have any follow-ups, please re-queue, and we'll try to get to as many of you as possible. And with that, I'd like to turn it over to Dr. Cieslak.
Hello, thank you. On April 13th, the Centers for Disease Control and Prevention and the United States Food and Drug Administration called for a pause on vaccinating people with the Johnson & Johnson COVID-19 vaccine. Out of an abundance of caution, we followed the recommendation and asked all vaccine providers in Oregon to pause administering the Johnson & Johnson vaccine. 6 women experienced a rare and severe blood clot known as cerebral venous sinus thrombosis within 1 to 3 weeks of getting a Johnson & Johnson vaccination. This appears to be extremely rare, with just 6 cases reported out of 6.8 million Johnson & Johnson vaccinations administered. This is the kind of rare event that the National Adverse Events Monitoring System can pick up so that it can be investigated further. If you've received a Johnson & Johnson COVID-19 vaccine, you should know that symptoms in all these cases have appeared within 6 to 13 days after vaccination. We're recommending that anyone who has already been vaccinated be on the lookout for symptoms for 21 days after vaccination. Anyone past this time frame is probably okay. Symptoms to look for include severe headache, leg pain, shortness of breath, and abdominal pain. Anyone experiencing these symptoms should see their healthcare provider or seek emergency care. We continue to believe that the existing COVID-19 vaccines are safe and effective and urge everyone who is eligible to get vaccinated. Thanks, and I'll be happy to take your questions.
Thank you, Dr. Cieslak. Okay, the first question, I see the first question here is from Rachel Alexander from the Salem Reporter.
Hi, thanks. My question is, since J&J vaccines have been targeted toward a lot of vulnerable groups in Oregon, migrant farm workers, homeless people, what is the state doing to ensure this pause doesn't disproportionately harm those groups or make it harder for them to get vaccines?
I'm sorry, you cut out there a little bit at the end.
Since J&J doses have been targeted towards homeless, unsheltered individuals, migrant farm workers, what is Oregon doing to make sure that this pause does not disproportionately harm vulnerable groups who were slated to receive those vaccines?
Right. We are trying to replace, for people who have scheduled to get the Johnson & Johnson vaccine, we're doing what we can to schedule them to get Moderna and Pfizer. But we have to acknowledge that the vaccine is in relatively short supply, and we're not going to be able to replace all of those doses expeditiously. So some of the people are going to have to wait a little bit longer to get their vaccinations, unfortunately, but we're doing what we can to kind of make up the difference.
Thank you. Now we'll go to Galen Eatlin from KGW. Go ahead, Galen.
Thank you. Thank you. Sorry, my mute was not unmuting. So yes, just to clarify a little bit, with those people who had appointments and were potentially going to get the J&J vaccine, what will they be facing now? Is there anything that they should be doing to get back in the queue? Will they have someone reach out to them? What exactly is going to happen now?
Right. They should contact whoever is the organizer of the vaccination effort that they were going to see. So, you know, if it was going to be if they were going to get vaccinated at a pharmacy, for example, they should contact the pharmacy and ask whether there's going to be a possibility of getting vaccinated at the same location anytime soon. Alternatively, they can call 211 and look for an alternative vaccination appointment.
Thank you. We'll now go to Lisa Balick from COIN.
Hi, Dr. Cieslak. A couple questions. First, are any of these 6 cases in Oregon? And also as a follow, this for anti-vaxxers is an example of why they don't want to get vaccinated. Do you worry that we're going to see a lot more people who say, look, I'm just going to put a pause myself in getting vaccinated at this point because of this?
None of the 6 cases were in Oregon. We have administered about 82,000 doses of Johnson & Johnson vaccine to date, and none of the 6 cases were among those recipients. You know, there are some people who are going to decline vaccination regardless, and I think that you know, if they were thinking that the vaccines are harmful anyway, this may be give them some additional fuel. But I want to point out that this was about 1 in a million vaccine doses administered, and we still don't know whether the vaccine was causally related to these side effects. The reason for the pause is that the federal agencies that are involved with vaccination, CDC and FDA, are going to look at the issue and try to ascertain whether they can determine a causal effect from the vaccine, and we'll go from there.
Great. Thank you, Lisa. Next question is Gary Warner, OHA Media.
Hi, thank you. We're lifting the limits on who can get shots next Monday. Will this event with J&J impact that, or are you going to go ahead with the eligibility?
At the current time, we're planning to move ahead with the eligibility. As I said, we don't really know how long this pause is going to be in effect. It's possible that upon further review, it'll be determined that the vaccine wasn't causal, or that you know, maybe a particular group shouldn't receive this vaccine. But at the current time, we're just waiting for the results of that and not making big decisions one way or another regarding the eligibility profile going forward. So a pause on vaccine for the time being, and venturing nothing more than that right now.
I know you don't have an exact time frame, but are we talking days, weeks, months for this to work out?
I think we're talking days. As I said, the Advisory Committee on Immunization Practices has been called to a meeting tomorrow, and FDA and CDC are going to review their deliberations and conclusions right after that. And I think we will know, you know, within a couple of days whether the pause is going to be more or less indefinite, or whether we'll get the green light.
Thank you.
Thank you. The next question is from Ben Botkin from the Lund Report.
Yes, 2-part question. How many doses approximately of the J&J vaccine does Oregon have on hand, and how long will those doses keep while not being used before you have to throw them out? Thank you.
I think we have about 212,000 doses of J&J vaccine. You know, the vaccine will keep at refrigerator temperature for some period of time. I don't recall. We could get you the shelf life of that, but I don't think that's going to be a concern for at least a few weeks.
Thank you, Ben. Question from Julia Silverman of Portland Monthly.
Thanks for taking the question. This is non-J&J related. I hope that's okay. I'm just wondering whether there's been any conversation in Oregon about spacing out the first and second Pfizer and Moderna doses. I've seen that sort of floated nationally as a way to speed up vaccination and perhaps more equitably reach populations of color that have not yet had as high uptake of their first dose.
Right, that's a great question. It's kind of a hotly debated issue, I guess, and I know there are some voices that are arguing for that pretty strongly. The CDC and the ACIP are still recommending that you go ahead and give the second dose, 3 or 4 weeks after the first dose has been given. And our Western States Advisory Committee met very recently, taking up this question again explicitly, reviewing the information, and again concluded that we should go ahead and be giving second doses. The concern is that you'll leave a lot of people with partial immunity that may predispose them to some of the variant SARS-CoV-2 viruses that are out there. So that's at least one of the concerns. But their recommendation, which we are following, is going to be to try to get as many people fully immune as possible.
Thank you, Julia. The next question is from Megan Glover, Central Oregon Daily News.
Hi there, thank you. Despite the current pause, would you all still encourage Oregonians who haven't received their vaccine yet to take advantage of whatever vaccine becomes available to them?
Absolutely. I mean, if we take the vaccine, the Johnson & Johnson vaccine off the pause, it will be because we have a lot of confidence in it. And meanwhile, we have no reason, despite, as I said, hundreds of millions of doses being given, to think that the Pfizer and Moderna vaccines are having any kind of a similar problem. And we know that they're very effective at preventing a disease that has killed a lot of people already. So we're absolutely recommending that those vaccination efforts continue.
Thank you, Megan. Next question is from Drew Reeves of KPTV.
Hi, thank you. My question, so we're talking a very small number of people who have experienced these side effects, 6 people in almost 7 million. How concerned should women who have already received the Johnson & Johnson vaccine in Oregon be? And what would your message be to people who are saying that they're now worried about their health?
Right. Well, again, it's to remember that although these are severe side effects that we take seriously, they're rare, as you pointed out, and the vast majority of anyone who gets the Johnson & Johnson vaccine, and even women who get the Johnson & Johnson vaccine, are at very low risk. But if you have gotten it within the past 3 weeks, we do recommend that you be on the lookout for a severe headache, not just sort of a mild headache that a lot of people get after vaccination, but a severe headache, shortness of breath, leg pain that may indicate a clot in one of the veins in your leg, or abdominal pain, that you call your doctor or seek emergency care right away. And this is for 21 days after vaccination. And remember, all of these cases occurred or had symptom onset in the 6 to 13 days after. So we're kind of creating a big buffer by asking people to look for 21 days. And if you're past that time point, we don't see any risk of your getting this particular problem.
Thank you. And the next question is from Zach Dumars of The World in Coos Bay.
Hi, thanks. I'm wondering if you're concerned at all that this pause and a lot of the headlines that we've seen around this for relatively so few cases, I'm wondering if you're concerned if this is going to increase vaccine hesitancy, especially among those groups that were kind of on the fence in the first place because of how relatively new the vaccine is, and this is going to push them back over. I'm wondering, if you're concerned about increasing that hesitancy and what the state is or can do to respond to that.
Sure, I think that's always a concern, and for the people on the fence, what I would say is that we have a lot of systems in place in order to look at vaccines that we don't have in place to look at other types of medications. I mean, there are not similar systems in place specifically looking at side effects of blood pressure medicines or cholesterol lowering drugs or antibiotics. These are extraordinary systems in place to find very rare side effects from vaccines. And, they were in place and found this 1 in a million kind of side effect that bears looking into. And this system, this vaccine adverse events monitoring system, does not tell us whether the side effect was caused by the vaccine or whether the adverse event was caused by the vaccine. It just says, hey, here's something interesting to look at. So generally, the federal government, the CDC and the FDA have additional tools where they can look at millions of people who have received something and see what the baseline rate is and whether there seems to be a particular association with the vaccine. So my message to those folks is, look at how sensitive these systems are for picking up significant adverse events. And I think, for me anyway, it gives me more confidence when they're saying that something is safe.
Thank you. Next question is from Drew Reeves, KPTV. Oh, I'm sorry, Dick Hughes from the Oregon Capital Insider.
Thank you very much, Dr. Cieslak. I appreciate your cogent explanations. I would like to ask a two-part question, which is there are always complications and adverse effects that can happen with any medicine. How would you compare this, the Johnson & Johnson vaccination concern with that for other medicines? I know that's a general question. Then a related question, do I understand correctly that people will not be informed to not show up for their appointments? It's up to them to find out or contact?
To be honest with you, I don't know whether or not the organizers of vaccine efforts, mass vaccination efforts, have a system for automatically, reporting to people who have scheduled an appointment. I suspect that some of the smaller efforts would be able to do that pretty easily, but I don't know whether some of the larger efforts have that capacity. Maybe we can get back to you on that afterwards. What was the other part of your question? I'm sorry.
Dick, are you still with us?
You're muted if you're talking. Did you catch the other part of his question?
I did not. I'm sorry. Dick, if you're still on, could you just re-queue and we'll get you back in the queue.
Yeah, so I don't know that every system has a way of reaching back to notify people. So all I would say is if you're in doubt, then you should try to contact the organizer of the vaccination effort.
Thank you. Next question is from Amy Green from the Oregonian.
So along the lines of that question that was asked several minutes ago about spacing out doses and whether that was something Oregon was discussing and considering doing, OHSU at its mass vaccination sites, the airport, for example, is scheduling Pfizer doses 4 weeks apart. So 4 weeks from the first dose to the second dose instead of 3 weeks. I was wondering if that's something that you have concerns about. When I asked about it, they said it was because it was simply easier to do because Moderna doses are spaced out 4 weeks apart.
Right. I guess our preference would be that because the Pfizer vaccine was tested at 3 weeks and is recommended at 3 weeks, that it be given at 3 weeks. But there's consensus among vaccinologists that a vaccine that's administered later than the recommended second dose, it doesn't hurt your immune response. If it's administered too early, it will hurt your immune response. So spacing something out from 3 weeks to 4 weeks is not going to harm the immune response. I suppose that it's going to take you an extra week longer before you'll have that full immunity. But when we're trying to get millions and millions of people vaccinated and we're using hundreds of different vaccinators to accomplish the task, I'd be reluctant to try to jump in and tell them that they should disregard these concerns on implementation. You know, they may have their own concerns about implementation. I want them to get vaccine into people, and if they can do it at 4 weeks, I think I'm happy.
Thank you.
Thank you. And Dick, my apologies. I see you back in the queue. Would you ask that second question again, please?
Thank you. And I apologize for being verbose previously. I'm just trying to put the concerns about the Johnson & Johnson vaccine in perspective because almost every medication has some type of side effect. And, you know, this is very, very rare. So how does this, is there any way that you could kind of give us some context of how this concern compares with other medications, not just vaccinations, but other common medications? Thank you.
Sure. You know, I would say that most of the common medications that we're used to thinking about, you know, drugs to lower your blood pressure, lower your cholesterol, antibiotics, drugs for rheumatic diseases, tend to have much more in the way of side effects. Although I think the thinking in the medical world and the public health world is that vaccines are held to a higher standard of safety because they're generally being given to somebody who doesn't have any disease. You know, when you're treating somebody with an antibiotic, for example, and taking a risk of severe allergic reaction or some such, you're generally treating a disease that, you know, might be very serious if left untreated, whereas vaccinating people, you are giving it to healthy people. So vaccines are generally held to a higher standard. So I think that, you know, these side effects or these adverse events that we don't know if they're side effects of the vaccine yet or not, are not being seen as commonly as you would see side effects from other medications. But by the same token, you know, they're very serious, and we don't want to be causing serious reactions in, you know, if we can help it. So we're holding it to a higher standard.
Thank you. Doesn't look like we have any other questions in the queue. I want to give people a minute if they have any follow-ups to do that. Okay. Seeing none then, I thank you all for joining us today, and I encourage you to send any follow-ups on, and we will respond to those. Thank you very much.
Okay, I think we should be clear. I kicked Jonathan Moda out by accident. Oh, 1 second.